Eye pain with a headache can be a very concerning combination of symptoms. In today's video, we are going to discuss the 5 major causes of eye pain that comes alongside with a headache. The last 2, you actually need to go see the doctor right away, so be sure to stick around till the end of the video. Hi everyone, my name is Dr. Saya Nagori. I'm a board certified ophthalmologist and you're watching the eyefacts.com channel. Now, the first potential reason for eye pain with a headache is dry eye. Dry eye can actually cause a variety of symptoms, and one of them is certainly eye pain. But why the headache? So not all dry eye patients will have an associated headache, but when dry eye leads to blurry vision as well as visual strain, a headache can usually come alongside with that because you are struggling to see what's in front of you. Now, patients may notice a combination of dry eye with headache when they are doing focused visual tasks. A focused visual task is something like driving, where you really need to pay attention and your blink rate goes down. This can then cause dry eye, which can then lead to visual strain. It may also happen when you're working for long hours at the computer or doing anything that's visually focused. For example, sometimes when I'm using the slit lamp in my office for hours and hours in a day, it might cause me to get some dry eye and a little bit of a headache. So what you're gonna do is take a break if you can. Obviously, if you're driving, you'll have to pull over to do this, but you wanna take a break. You can rehydrate your eyes and also take some over-the-counter pain medication. If none of this works, you should go in to see your doctor. The second potential cause of eye pain with a headache are eye allergies. And actually not just eye allergies, but even just allergies in general. Environmental allergies can cause eye symptoms and they can also cause headaches. Sometimes the eye can feel scratchy and itchy. It can also get light sensitive, and headaches can go along with this. But the interesting thing is the headache might be just a completely unrelated symptom to the eye symptom and just related to the allergy itself. So in the case of an allergen like dust mite allergy, that can cause a headache for many patients, and it can also cause eye symptoms. So it's not that the eye pain is causing the headache in this case. In this case, the eye pain and headache are both being caused by the allergen. The third reason for having eye pain with a headache is migraines. Migraines are a common cause of having repeated headaches, and they can also come along with eye pain. People with migraines can also feel nauseous or sick to their stomach. They can also be very light sensitive, and they can also see flashing lights or sort of a kaleidoscope-like shape. This is actually called a visual aura. And the interesting thing about having a visual aura is sometimes it may or may not come along with a headache, but it can. The eye pain and migraines can be felt somewhat around the eye, and sometimes this is why migraines are mistaken for sinus-related headaches. Now, the fourth potential reason for eye pain with a headache is something called iritis, and this is definitely something that you're gonna wanna go in to see the doctor for as soon as possible. What iritis is it's an inflammation inside the eye, and it will cause the patient not only to have eye pain, but it usually also causes light sensitivity and eye redness. Now, beginning stages of iritis may not have redness because the iritis is just starting up. This is why you need to go in if you're having eye pain and a headache, because if it is iritis, this is certainly something that requires treatment. What you will need to do likely is be put on steroid eye drops. And if you don't get treatment in a timely fashion, the inflammation in the eye can actually change the way the structures in the eye look, and this change could be permanent. Now, like I mentioned, some patients with iritis can have very, very red eyes, and for some patients it could be more mild. The inflammation itself can only be seen using a special microscope that's inside your doctor's office, so you're not gonna be able to tell if your eye redness is from dry eye or iritis or something else. So the best thing to do is get checked out because it's not something you're gonna be able to diagnose at home. Now, finally, the fifth and absolutely most concerning reason for eye pain with a headache is a sight-threatening eye problem that has to do with eye pressure. This is something called angle closure glaucoma. And when it comes on suddenly, we call it acute angle closure glaucoma. And the eye pressure in this situation shoots up very high, very, very fast. And the eye pain comes on suddenly, and this problem causes a headache as well in many, many patients. Now, along with the headache, some patients can experience nausea. They may even feel vomiting. The eye typically looks very, very red. The pupil may be even kind of fixed and not really reactive to light. Now, this is a true eye emergency, and it needs to be treated right away. So this is not call your eye doctor. This is go into the emergency room. If it is possible for you to get into your ophthalmologist and they have a laser in their office that they can treat you with, great, you can go in to see your eye doctor. But if it happens outside of office hours or you're calling around and no one can get you in, this is an eye emergency. It truly needs to be treated immediately. So if you cannot get into an ophthalmologist right away, you need to go to the ER. Now, it's also important to note that not all eye doctors are going to have the specific type of laser that you would need. So if there is any question, head to the emergency room. Now, what patients will have to do in this situation is they'll have to have their eye pressure lowered. This can be done with drops before the laser is set up. Now, in some cases, the laser may not be able to be done if the eye is just so hot and red that it's difficult to actually see. And in this case, you may need some kind of IV treatment to lower the pressure first before the laser can be done. Either way, time is vision in this scenario, and you will need that pressure lowering, whether it's through eye drops, an IV treatment, or with the laser procedure that will probably have to be done eventually. Now, patients who have eye pain and a headache that actually have acute angle closure glaucoma, it is very dramatic. It is not something that is going to be just a slight discomfort. You are going to have significant discomfort, significant pain, and also usually some visual associations that your vision is getting blurry, you're not seeing quite right. But if there's any concern, the best thing is just go in to see your eye doctor. So in summary, if you are having eye pain and a headache, it is always a good idea to get it checked out. Now, if you have a history of dry eye and you're pretty confident that it's from your dry eye and you do your normal dry eye treatment and things resolve, great. But if you have any concern that it could be something more serious, it's really important to go in and have it looked at professionally. What questions do you have about your eyes? Drop them in the comments below. Really appreciate you guys being here. If you found this helpful, hit the subscribe button. Thanks for watching.